Well, how is your heart doing? And how about your arteries? These are questions that all of us need to consider. And Dr. Saji Jacob is here to help us with that. Dr. Jacob is a cardiologist with Cardiovascular Associates, affiliated with Brookwood Baptist Medical Center. First of all, thanks for being with us. We appreciate you being here. The problems with your heart and with cardiovascular issues is something all of us need to be aware of, but who is most at risk?
The traditional risk factors, the important ones being high blood pressure, hypertension, diabetes, high cholesterol, smoking, and family history.
Okay. All of the things that really affect our health in so many different ways. But what are some of the symptoms that might be nagging at you that should wave a little red flag?
The most common symptoms are chest pain or chest pressure. Some people, it may be shortness of breath. There's a lot of lay press stories on atypical symptoms in women. And typically it's shortness of breath, fatigue, but chest pain or chest pressure remains the commonest.
Okay. Many of those are things that we can blame it on something else, especially fatigue or shortness of breath. When do you know it's time to get it checked? Go to a doctor.
The more risk factors you have, the more attention you pay to your symptoms. And the best way to start out is by going to your primary physician, and they will guide you well.
Okay. And how is it treated?
The risk factors or coronary disease? It's a combination. You've got to treat both. So risk factors are traditionally treated by the primary care physician. The hypertension, the diabetes, and lipidemia. There's not much you can do about your family history, but you need to be aware of it. And once you have symptoms, there are medications. If medications don't control your symptoms, then you go ahead and do a stress test, and need be, you may need an arteriogram. And if you have blockages that can be fixed, in some situations they need to be fixed, either with stents or bypass surgery.
But these are things you should not ignore.
Absolutely.
Do you see that happening, though, that people explain them away and say, oh, I'll get to that, and then they don't?
Many times. And then sometimes, and most of the times, they don't take care of their risk factors. And the first time you see them is in the hospital with a heart attack. It's not common, but we see it often.
But certainly that's not what you want to happen to yourself or to someone you love.
Absolutely.
So any suggestions on how to convince someone that they really need to focus on this?
If you have symptoms, go and see your primary physician, because it's not worth losing a life on something that you can potentially treat.
And be aware of your risk factors.
Absolutely.
Know what your cholesterol level is.
Right. Don't smoke.
Don't smoke. And get exercise.
Exercise.
All of those things we know we're supposed to do. Right. So some good, perhaps New Year's resolutions.
150 minutes a week. That's a recommendation for exercise.
For exercise. All right. Thanks for being with us, Doc. We appreciate it.